Hello, and welcome to our show today. I'm Tracy Tubbs, Cancer Control Specialist with the Kentucky Cancer Program. Colorectal cancer is the second leading cause of cancer death in Kentucky, with more than 2,600 cases of colorectal cancer diagnosed in the Commonwealth each year. About half are diagnosed at a late stage. Tragic because when found early, the 5-year survival rate for colorectal cancer is more than 90%, and more than half of colorectal cancer deaths could be prevented with regular screenings. Kentucky has the highest colorectal cancer incidence rate in the United States compared to all other states. Kentucky is tied for the 4th highest colorectal death mortality rate in the United States compared to all other states. Kentucky has made tremendous progress in increasing colorectal cancer screening rates, but there are still many Kentuckians who have never been screened. In 2012, 65.9% of Kentuckians have been screened. The goal for Kentucky is to be at 80% by 2018. In 2008, Kentucky passed a bill to increase awareness of education about screening for colorectal cancer, which also allowed funding to become available, and the Kentucky Colon Cancer Screening Program was created. Joining me on the show today are some experts about the Kentucky Colon Cancer Screening Program to tell us more about the program and who can benefit from the program. Kaylene Cornell and Donna Heldenbrand are both from the Purchase District Health Department and are actively involved in the screening program here in our area. Good morning.
Good morning.
So tell us a little bit about what you guys do at the health department.
Well, I'm the health education coordinator there, and I've been with the district for 8 years now. We primarily promote educational awareness to schools and communities, as well as collaborate with area agencies in working with different policy changes and helping each county with working towards healthier communities.
Mm-hmm. And Donna?
I'm a public health nurse at the health department. So my role in this was I was trained through the program to be a nurse navigator. So I do the one-on-one usually with the patients and get them connected with the program, and I kind of route them through the system that way.
Well, thank you both for joining us today.
Thank you.
First, let's start with some information about colorectal cancer. What exactly is colorectal cancer?
Well, colon cancer is cancer of the large intestine, which is the colon, and the lower part. It's the lower part of your digestive system. Rectal cancer is the cancer of the last several inches of the colon, and so they're normally combined together and called colorectal cancer.
Okay.
Most cancers of the colon begin with a small benign cluster of cells, and they then are called the adenomatous polypus, I think is. Anyway, that's my best shot at it. But over time, these polyps can become possibly colon cancers, and they start out. They can be very small and can produce few, if any, symptoms. You may not even have any symptoms from it, and that's why it's so important to have that regular screening done.
That's right. I know colon cancer has very little symptoms, right?
Mm-hmm. Yes.
So who gets colon cancer more frequently, men or women?
Both affects men or women. Majority of the people are age 50 or older, but it doesn't mean that younger ones can't get it. I mean, we do see younger ones. It's just that the older we get, the higher risk.
So the risk increases with age?
Yes.
Okay. What are some of the risk factors for colon cancer? I mean, just like a detailed explanation for everyone to understand.
African American, that race definitely has a greater risk. If a parent should have polyps or colon cancer, their son or daughter needs to be screened 10 years prior to the age that parent had the polyp or colon cancer. And of course, anyone who has a history of, inflammatory intestinal, conditions such as colitis or Crohn's disease, those put you at a little higher risk. Diet is a huge part. We always talk about, to have a healthy, longer life, you need to have that, healthier diet. And this is indeed impacting this. More of the high fat, more of the red meats,
Everything
low
that we
fiber.
like to eat normally. Right.
Yes, yeah, but it does, put you at a higher risk, and also, more of the sedentary lifestyle.
So if my father was diagnosed at 50, I would want to get screened at 40. Is that right? 10 years before?
Especially if
absolutely.
he had polyps or had a risk factor there, you would definitely need to be screened earlier.
Right.
Than the 50 or even age 45 in African Americans. So yes.
Now, does alcohol play a role in this at all, like drinking alcohol?
Well, healthy lifestyle is definitely a factor in any form of cancer, but yes, it can be a factor in colon cancer as well.
Yeah, when they talk about, heavy use of alcohol, they're just talking about men shouldn't have more than 2 drinks per day, and women should not have more than 1 drink a day. And I think, heavy use, you're thinking a lot more. But in essence, they're just talking, 2 or 1 drink a day.
And of course, smoking is also another risk factor of colon cancer. So you need to address that in your life.
People with diabetes,
Yes.
Insulin dependent, is also another risk factor.
So how does colon cancer develop, and how can it be prevented?
The prevention of it would be, looking at those risk factors, eating a healthier diet, eating more high fiber foods, drinking your water, not drinking alcohol, exercise, daily. Right. Those, really help. And just be aware of family history, be aware of, your body, and looking for any symptoms.
Right. Like blood in the stool.
Right, because there's not a lot of early symptoms with colon cancer. I mean, you may have a little bit of intestinal problems, diarrhea, constipation, those type of things, just subtle changes. So that's why it's so important to get these screenings, because you may not even be having a problem or notice that you're passing blood in your stool, when in fact you may have a polyp that's doing just that. So really, screening is the only effective way of finding these in the early stages, so that they won't lead to colon cancer and they can be, treated and removed.
Right.
So.
And I know when you hear the word polyp, people get scared, but those are easily removed.
Absolutely,
no pain,
absolutely.
with a regular colonoscopy, right?
Right, and it
So-
doesn't mean that they're cancerous.
Right.
They vary. That word benign means that's exactly it. It's just, a cluster of cells. It doesn't necessarily mean that it's cancer. It can turn into it.
What is a polyp? What is a polyp made of, or what is that? What does a polyp consist of?
Well, it really is, like I mentioned earlier, that growth that shouldn't be there. I mean, when you look
Abnormal
at
cells. Yes.
when you look at the inside of the colon, it shouldn't have any of those extra growths.
And most of them are benign, but then you get that occasional abnormal cells that will continue to multiply abnormally, and that can lead into the cancerous cells or the precancerous cells. So that's why it's so important, to go ahead and find those and get those removed and biopsied by the gastroenterologist.
And I know at the health department you can get a kit for free to do without a colonoscopy, right? Is that?
Yes, the FIT tests. Right.
And they can do that in the comfort of their home and send that off, and everything's included.
And it can be tested yearly too.
Right. The FIT test is a fecal immunochemical test. It's highly sensitive to any blood in the stool. So even though you're not seeing any blood when you have a bowel movement, you may in fact be passing a little blood. So this kit basically, and I brought one with me today, and it's very easy. It's not difficult to do, but when you have a bowel movement, you basically just take the sample of that stool with this little tube here.
Kind of like painting.
Yeah, you just kind of stab it a little bit. You get a little material on there, and you put it back in there, and you bring it back to me, and basically that's all there is to the test. It's very easy to do, and we process the test at the health department, and that basically is how we determine if there's any blood there that can signal a polyp.
Right.
And we recommend that you do those tests yearly. You can come into the health department and get those tests at any time and ask for me or any of the nurses.
I love that, because it's free. You can do it in the comfort of your
It's
home.
one time, you know, one bowel movement, and it's in your comfort of your home, and you bring the test back, and, you know, it's very highly sensitive to blood.
And the difference, it can tell the difference between animal blood and human blood. So I do like that as well.
You don't have to change your diet at all. You don't have to change your medication regimen. You know, it's very, the old, you know, fecal occult blood stools, you had to actually, you know, change your diet and medications before you even took the sample. And you had to do it like, you know, 3 different bowel movements. Well, now you don't. It's just one simple test at home, takes a few seconds, and you can mail them back to me or bring them to me at the health department.
And I like this too, because I know the last test that we had previously, if it touched water, it was you couldn't use that test
Exactly.
anymore. So and this one,
that's not a problem. That's not a problem at all.
It's very
really
accurate
good.
too.
And it's very accurate.
Yeah.
Yeah. In
especially
detecting
when,
problems.
since there's no really symptoms before, so this is a
Right.
good way to.
And
if you do not want the colonoscopy, you can come and get this fit test. And
yes, and it's no cost, whether you have insurance or you're uninsured. There's no cost to you. So you know, that's another benefit that the state provides for us right now, and that we have, you know, funding that you can get the test.
Now, do they need to make an appointment to get the fit test, or do they just come in and ask for that?
You do not have to have an appointment. Now, you may have to wait till I'm available between patients, but you do not have to have an appointment to get the test at all.
Okay. Well, that's very convenient.
Yes.
So I'm glad that you guys offer that.
Yes.
So what are some of the symptoms of colon cancer? But when you do see symptoms, we know it's blood. And what are some other things? Like some pains? Will you have any aches and pains anywhere?
Yeah, you could have stomach pains. You can have rapid weight loss, a change in your bowel habits, you know, diarrhea, constipation.
The blood in the stool.
Right. I mean,
On it.
is more that, you know, you just may notice subtle changes at first, and you may not. That's why the screenings are so important, because, like I said, there may not be any changes, any major changes. You know, you may contribute it to your diet, or you've eaten something bad, or that kind of thing. So, yeah.
And this time of year, everybody's trying to lose weight, so you know, that's kind of scary. If you are losing weight, you think that it's because you're really trying, when it actually could be some
problems there. Yes.
Different.
Yes.
So there's 2 kinds of ways to find out about colon cancer. I know we've talked about the FIT, and tell us a little bit about a colonoscopy and how that happens and what that all entails.
Well, let's talk about the SUPREP. Let's go back to that, the PrEP, because everybody's always worried about the PrEP. You know, that scares
it's gotten better over
It's gotten better. Most of the time, the GI doctor will prescribe the SUPREP, we call it, and it's just a little 6-ounce bottle. And you drink that usually the afternoon before the test. You chase it with 16 ounces of water. It's only 6 ounces. And then you chase it with 16 ounces of water. You do that again, say at 8 o'clock. So you're only talking about really 12 ounces of liquid other than the water. It does cause, you know, to clean out your intestines the day before the test. You know, let's just say 5-pound weight loss automatically.
There's
you know,
it's
great. There's a positive. And so the PrEP is a lot better. And then you go in the next morning to the doctor's office for the colonoscopy. Pretty much the colonoscopy, during the colonoscopy, the patient lies on their left side on the examination table. You're given a light sedative. There's not any pain involved. Pretty much the doctor will insert a long, flexible, lighted scope into your anus and rectum, into your colon. The scope inflates the large intestine with carbon dioxide gas, and it gives the doctor a better view of the intestines. Then that transmits a video image from the large intestines onto a computer screen, and then they remove the tube, the scope that way, and that's what shows them. That's basically the whole procedure. It's quick. You wake up. There's no pain involved. You feel normal. Someone needs to, of course, drive you home because it's a light sedative. But, you know, it's really a simple test, and most insurances now are paying for the screening. Yes.
And I've had one before, and I know that it was number one, it was the best sleep I'd had in a while.
It's not bad, just a
And
light
yeah,
sedative.
I just,
Yeah.
you know, I went to sleep and then I woke
Absolutely.
up. And the
Yeah, you
test
wake
was
up
very
quickly
good.
and you're
Right.
able to just
Function. Yeah.
It's not like you have to go home and sleep for
Right.
4 hours. You know,
Right.
you're just,
Yeah.
you're good right
Yeah,
afterwards.
right.
So.
And you get the details about it pretty soon. I mean, pretty quick. So.
Yes, they tell you, you know, before you leave.
Right. Right.
Absolutely.
So that's good. So the screening tests that are offered through the health department that are available to Kentuckians, how do they find out which one they qualify for? I know we have the Kentucky Colon Cancer Screening Program now. So how do they find out which ones are available to them?
Okay, you're going to come in and you're going to see me at the health department. Now, the River County Health Departments also provide this. So if you're closer to Ballard County, Fulton County,
Hickman.
Carlisle, Hickman County, these nurses are also trained to do this.
Okay.
But basically what it is you come in and see us, we fill out a form. As we're doing the history, we ask you if you've had a colonoscopy before, if you're at risk for
Right.
colon cancer, the last time you've been screened. And with this form, we make sure, now whether you have insurance or not, you're still going to get a kit.
Right.
But to qualify for the KCCSP program, which is funded, you know, Governor Beshears put through, where we can help pay for the colonoscopies.
That's great.
There's a few guidelines. It's for folks in Kentucky. You have to be a Kentucky resident. You have to be uninsured, a U.S. citizen. You have to be what we call 250% of the poverty line in Kentucky, but you can still make quite a bit and still qualify for that
Yeah, I
amount.
think a lot of people think, well, I
Yeah,
don't.
you know, you have to not have a job. No, working people can still qualify for this. You have to kind of be in the age group, the 45 and older if you're African American, or 50, you know, through age 64 if you're not. But if you have risk factor, the family, you know, health risk factors, then that will qualify you. So those are the eligibility guidelines there, basically, that get you a kit.
Okay.
So
So Donna, say that I took the FIT test, I took it home, I did that, the prep and everything, and it came back positive. What would be my next step? Would you follow me through that? Or?
Absolutely. When you mail or bring the kit back to me, and then I find that we process it at the health department, and I find out that the test is actually positive, I'll counsel you and let you know, and then we refer you on to we're contracted with Mercy Gastro right now. Mercy Gastroenterology is at Lourdes Hospital, Dr. Shane Hendon. And we pretty much will set you up an appointment with that group, and they will set up the colonoscopy for you. They will also see you if you have insurance or if you don't, but if you qualify under our program, then they actually bill us, and then we cover the cost of the colonoscopy through the grant.
Yeah.
Yes.
So would I have to do this every year?
It's recommended that you do the FIT test every year. Even if you had a colonoscopy the year before and they didn't find polyps, these FIT tests are recommended every year in case you get new polyps that were to develop.
Right.
So yes, and you can come in the health department and do that. You could do it through your private doctor if you wanted to get a kit through them. It's not just the health department that has them. But now, like I said, if you do qualify, you know, for the colonoscopy, then we connect you and make you an appointment with Dr. Shane Hendon, and we'll get you screened through that way. Now, occasionally, when we do this eligibility form and we find out that they are actually at high risk, that they've had colitis, or they've had Crohn's disease, or they have a strong family history of colon cancer, then I may not even give a FIT test to them. I may go ahead and schedule them on in for the colonoscopy. So, you know, there is, in certain circumstances, that we don't even actually do the FIT test. I feel like that they're at high risk enough that we go ahead and schedule that colonoscopy and get that done. Yes.
Okay. Is there any incentive for someone that qualifies for this program if they come in for a screening?
We don't hand out any incentives right there at the clinic. However, for our outreach, we are planning a a health fair, colon cancer awareness event at Mount Moriah Missionary Baptist Church on 8th Street in Paducah, and that's coming up April 23rd. We're really excited about that. We're going to have a lot of vendors there. We're going to provide food for people who've come, and we'll have the inflatable
Yeah, we'll have
colon
the inflatable
there.
colon, and they can actually walk through that and see polyps. Good polyps and bad polyps, so
Yes,
thank you for having us
and
there.
that's just an excellent visual. I
Right.
think for people to really understand what are they looking at. When you're hearing the tube is going up around and looking, they can actually see this is what we're looking at when you walk through that inflatable
Right.
colon.
And I'll also be there that day, and I will have some fit tests for anybody that feels like that they need a screening or they haven't had one in a year. I can actually give the fit test out there, and they can mail them and send them back to the health department for me. So I'll
that's
be there
great.
that day,
Right.
and it'll be free to them for me to
And I
do
know
the fit test.
right in that area it meets a lot of those demographics that we were just talking about. So
Yeah, we hope that
that's
people come out.
fantastic.
We'll have door prizes. One of them's going to be some farmer market vouchers. So
Yeah,
we're
to promote eating healthier, right?
Yes,
right.
some giveaways, sure.
Well, is there anything else you guys would like to share about colon cancer or how you get screened, or how they can find out more questions if they need to talk to you all?
Well, I mean, you can always call us at the health department, and ask for me specifically, and I can give you information then about that, if there's anything additional with that. I just kind of wanted to say that, the number one lifestyle change to prevent colon cancer is to get screened. The best test is one that's done. They have passed a new law now that if you go in for a screening colonoscopy, and even if they find polyps, they can't change it to a diagnostic screening test where they might charge you, that it will just stay a screening colonoscopy. So that's important too when people worry about the financial aspect of it. Screening prevents colon cancer deaths. I just wanted to read this statistic, but it said in the 7 years since efforts have increased for colon cancer awareness, that Kentucky has moved up from 49th at 37% to 23rd at 63% of incidents in screening. So more people are getting screened. Now, you may not always have every physician that talks to you about getting colonoscopies, but if they don't, bring it up. I mean, tell them I think it's time, or I'm having problems, and get that screening. The reduced incidence of colon cancer in Kentucky has pretty much went from 68.8% in 2001 to 53.8% in 2012. So that shows a difference in how many less people are actually getting colon cancer because they're getting the screenings that they need.
Right. Well, just in review, I thank you guys first for coming.
Sure.
But colon cancer has very little symptoms. So we're trying to get education out there for people to get early detection, to get screened early. So we have the FIT test, we have colonoscopies, all readily available at their request.
And a grant through the state that's helping us do this with very little cost to the patient.
And we really want to see, Kentucky turn around and have much lower numbers. I mean, it is still a true significant public health, problem. And the only way, like you said, it's the testing, and it's very simple. It's not like what it used to be years ago. And I think people need to understand that being proactive is worth saving a life.
It absolutely is, because the less people that we can get with the incidence of colon cancer, the less the families will be affected. I mean, me personally, I've had 3 family members die of colon cancer. So it affects everyone. I'm high risk. I'm under 50, but I've already had 2 colonoscopies. So, it affects so many families, and it's only second under lung cancer, and it's right up there with breast cancer, and people don't think about it being affecting that many families, but it does.
And you're a great testimony. So.
Yes, I mean, I've lost very many, I've seen it affect my family in so many ways. And years ago, it was, you didn't think about it. You said, we get screened every 10 years. Well, not necessarily. If you've got polyps, you get screened sooner.
Right.
If we can make more the public aware to be proactive with their health and to get screenings, then maybe we can catch the polyps before they get cancerous, and and it's curable, and it can be curable, and not so many families affected. So yes.
Well, thank you for joining us today. For more information regarding the Kentucky Cancer Control Screening Program and eligibility requirements, please check with your local physician or call us at the Kentucky Cancer Program office at 270-442-1310. You can also go online to the Pathfinder website, an easy online tool for cancer prevention screening, treatment, and support services at www.kykcancerprogram.org. I'd like to thank Kaylene Cornell and Donna Heldenbrand, both from the Purchase District Health Department, for being here today. Here at the Kentucky Cancer Program, our mission is to reduce the burden of cancer in Kentucky through education, research, and service. Have a great day.